The time now 7:15. As we approach fall, health experts warn of a rise in RSV, COVID, and the flu. It makes this National Immunization Awareness Month extra important. Dr. Carrere, a family medicine physician, joins us now with details on why it's important to get these routine vaccinations. Dr. Carrere, good morning to you. Are you, what kind of a year are we off to here? Are we in a little bit of, I know that there's been kind of a bug going around. People are talking about COVID coming back in a small way anyway.
Yeah, we've noticed a spike in COVID, or I certainly have in my practice, and so certainly recommending the best way to prevent viruses is to get vaccinated.
You know, one of the things about vaccines that doesn't always get attention is obviously you focus on your own personal health, but you're protecting, perhaps a vulnerable family member, a baby, an older person. It's the health of the species, if you will.
Yeah, we call that herd immunity. That's exactly right. And so very important to get vaccinated, not only to decrease your risk of disease, but to, as you said, protect those around you, your young baby, your grandmother, and it's a good thing to do for the community.
Some vaccinations are one and done, for your whole life. Others you need to stay up to date, obviously by talking with your doctor, I guess.
Yes, sir. Exactly. So some vaccines that we should be getting regularly, and that you need as you get older, the flu vaccine. I think we're seeing that the COVID vaccine might be something we'll need to repeat. There's the newer RSV vaccine that's now available for infants, but also adults. And so you should see if you're recommended or eligible for that. And then, some regular repeats would be tetanus vaccine. You should get that every 10 years. I remind my patients, especially during hurricane season, because you never know if you'll be picking up, heaven forbid, but you never know if you'll be having to pick up after a storm. So getting the tetanus shot is very important.
That's a good point. Let's face it, whenever you have a discussion about vaccines in this day and age, the elephant in the room is the COVID vaccine and the pushback against it, or to some degree people who say, I don't want to get a sixth jab. How are you addressing that with patients, and is that spilling over to any other skepticism about vaccines?
Yeah, I think so with many vaccines, you'll have some side effects, and so people obviously don't want to be achy or feel sick for 24 hours. So what I'll often, explain or offer to patients is, you might feel achy, have a low-grade fever, have pain at the site for a day, or you could get the full-on disease, the flu, COVID, RSV, and be sick for, up to a week or even further with complications. And so that is one thing. And vaccines are really tested rigorously by the FDA. There are 4 phase trials for vaccines, multi-phase trials. And so, that they are considered safe. That being said, talk to your doctor about what vaccines would be recommended for you.
All right. Great advice. We appreciate your time this morning, Dr. Carrere.
Thank you.